Dr. Brent Beasley always wanted to be in a band. His grandfather gifted him a guitar as a child, and his dad quickly enrolled him in lessons. And though Beasley would write songs, including one that was played at his wedding, his early dreams of becoming a musician took a back seat to his career as an internal medicine physician. However, his two passions merged in 2022 when Beasley's dad was dying from Alzheimer's disease.
My father passed away with Alzheimer's disease at the end of his life, but I could play guitar for my dad and his face would brighten and he would connect with some of the songs that we used to sing and enjoy as a family.
That same year, Beasley started at a new organization working with Alzheimer's patients and came down with a mild case of COVID. Though he was convinced it wasn't serious, Beasley's family noticed when he suddenly couldn't remember the rules to a board game. It wasn't long before the people at his new job took notice too.
After a few months, the medical director came to me and said, "What's wrong with you?" We had scribes at that organization. She had been told by the scribes that I was repeating questions to patients over and over. But that began my journey of trying to figure out what was wrong with me, what was going on.
After Beasley had a brain scan and spinal tap, they came back with one conclusion. At age 57, he had Alzheimer's disease. While this wasn't exactly out of nowhere, his dad and grandfather had the condition and COVID can sometimes accelerate its progression, it was a cruel twist. The doctor who treated patients with Alzheimer's for more than 30 years was now on the other side of the diagnosis. Beasley had no choice but to retire. He now spends his days bike riding, babysitting his 7-month-old grandson, and of course, playing music. It's one of the only things that Alzheimer's hasn't touched.
Technology, I used to be really good at it. Technology is very hard for me now that I have Alzheimer's. Music, I don't miss a beat. I still continue to be able to play, to sing. I've been able to enjoy all sorts of music. It's a constant for me. While other things are changing, I think music is a constant.
As Alzheimer's progresses, cognitive function withers away. There are medications that help slow the disease, but they're expensive and don't work for every patient. Beasley wrote in the Journal of General Internal Medicine that his experience as a doctor made the available treatments seem hopeless. Medications couldn't stop the spread of the disease, and the inevitable call to hospice seemed right around the corner. But even with all the destruction that Alzheimer's can cause, the part of the brain that remembers music is usually spared. A 2022 study in the Annals of the New York Academy of Sciences found that music actually helps slow the progression of Alzheimer's and dementia. In fact, nonverbal and non-reactive patients will often start talking or moving around when familiar songs play. They can recall memories that they had previously forgotten, and they tend to show less distress and agitation. Dr. Felicity Baker from the University of Melbourne researches music therapy and its real-life impacts.
We know that many family carers, they often talk about how music helps to see the person behind the dementia because they have a glimpse of what they used to be like because they become animated. They often start to talk when they don't talk much, and what they say can often have much more coherence when the music stimulates these pleasurable memories.
Baker is the head of a program called Match, which uses AI to predict a patient's mood and then plays music to prevent agitation and confusion.
We already know that music regulates people's arousal level, and usually a music therapist would do that. But we know that there aren't enough music therapists in the world to service the 55 million people with dementia. And not only that, a music therapist isn't there 24/7. And sometimes, if a person with dementia, they often get confused about day and night, so they might just get up in the middle of the night and start wandering around the house, which can be quite challenging for a family caregiver. So teaching them strategies and having an automated system like this will help in those moments when there isn't any other help available.
Research has continuously proven that music can be a powerful therapeutic. Beasley used it with his father and now uses it for himself. When sitting down for this segment, he was meticulous with his words and had difficulty recalling the name of a band he'd seen perform a couple days before. But when he picked up his guitar, Beasley had no issue remembering More Than a Feeling by Boston, whose album he's had since junior high. When asked about his favorite Paul Simon song, he didn't hesitate to play the 59th Street Bridge song.
Moments last night, hobble down the cobblestone. The
A lot of the music Beasley plays evokes memories of his youth, and music therapy uses that nostalgia to their advantage when treating patients. Older songs are often the most effective because the memories they uncover provide a source of comfort. But not all music has a positive effect. Some songs have negative memories attached to them, which means that music used for therapeutic purposes has to be the right music, or else patients may get agitated or distressed, the exact opposite of what it's used for.
One of the things we know about people living with dementia is that the same song doesn't necessarily have the same effect every time you play it. It will depend on the person's level of arousal, what they need right at that moment.
Baker describes music therapy like an aspirin, where patients use it as needed. For instance, if a patient always becomes distressed while showering, playing music before and during can help calm them down and prevent a serious fall. The MATCH program is made for home care, where the need for effective treatment is the most dire.
Through the wearables that they have, the system will detect a change from their usual baseline, which is an indicator that an event of some kind is approaching. And the idea is that then it activates music that matches the agitation level and the arousal level of the person to then help to regulate it and return it as close to baseline as possible. And the system sort of draws on, it looks at the components of music, such as tempo, genre, year of the song was released, and has a whole set of musical parameters that in combination, the system will learn which combination works best for each person.
But consistency is key for music treatments like the MATCH program. Research shows that some people can speak and recall memories better during music therapy, but this progress fades after treatment. In addition to regular use, the MATCH program is able to grow with each patient's needs.
We know with people with dementia that their needs will change over time, and so the types of intervention through music that they will use will also change as their disease progresses.
For Beasley, music takes him back in time before his diagnosis. He's a rock and roll guy, so the music of his youth is what he gravitates toward the most. When he listens to Dan Fogelberg, he's transported to a concert he went to in his 30s. And Elton John comes through the speakers when he wants to revisit his 20s. Music and family have been intertwined for him ever since his grandfather bought him his first guitar. Now, he uses it to express himself and his love for his family members, including his young grandson, Francis.
I've always enjoyed writing music. Sometimes songs come very difficult, and sometimes songs come very easily in terms of the poetry. I've written a song for my grandson. Francis fancies fantasy comes, bird drills in gardens of golden and green, chases a bunny around a tree, funnily laughing and giggling, there he is.
You can find more information about Dr. Brent Beasley, Dr. Felicity Baker, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer this week is Annabelle Rivera. Our lead producer is Kristen Farah. I'm Greg Johnson.